Hello, everyone. My name is Anna Wagner. I have chosen physician-assisted suicide as my healthcare issue. Physician-assisted death is certainly a controversial topic, and I will be discussing why this topic creates issues within healthcare. It is important to understand the definition of physician-assisted death. According to Quill and Sussman, physician-assisted death refers to the practice where a physician provides a potentially lethal medication to a terminally ill, suffering patient at his request that he can take or not at a time of his own choosing to end his life. It is also called physician-assisted suicide, physician aid in dying, and patient-administered hastened death. Physician-assisted death has been a healthcare issue in the United States for several years. It is controversial and is only legalized in 7 states and Washington, D.C. Above is a timeline of the legalization history in the United States. Oregon was the first state to pass the Death with Dignity Act in 1994. More than 10 years later, Washington passed their Death with Dignity Act in 2008. That same year, Montana legalizes physician-assisted suicide. In 2013, Vermont becomes the 4th state to allow physician-assisted suicide. In 2015, California became the 5th state to legalize physician-assisted suicide. Colorado was next to legalize physician-assisted suicide. And in 2017, Washington, D.C. becomes the 7th jurisdiction in the United States to legalize physician-assisted suicide. And Hawaii is the most recent to legalize physician-assisted suicide, having just happened this month on April 5th, 2018. This map has not been updated to include Hawaii, Colorado, or Washington, D.C., but I like this picture because it reflects the accuracy of the issue in the United States. As you can see, a vast majority of states have not legalized physician-assisted death, and only a few have. That just shows how controversial the topic is within the country. So now we will move on to why physician-assisted death is considered a healthcare issue. One of the first reasons is that it violates the Hippocratic Oath. The Hippocratic Oath is a healthcare oath that states in part, "I will give no deadly medicine to anyone if asked, nor suggest any such counsel." Several healthcare professionals, such as physicians, state this oath before practice. Physician-assisted death seems to violate this oath. Also, it's an issue because of inaccurate diagnoses. Healthcare professionals fear physician-assisted death because of the chance of inaccurate diagnosis. Ganzini and Back mentioned that a patient was given only 3 months to live, however, her diagnosis was inaccurate. What if this patient had chosen physician-assisted death before learning of the true diagnosis? Nationally, physician-assisted suicide has been a political debate in the United States since the early 1900s. The first state legalized physician-assisted death in 1994. Several states have created legislation in favor of, but have been denied by voters or denied in state Congress. Some states have created legislation that prohibits the state to be involved in physician-assisted death. A con to physician-assisted death that creates an issue is that it may violate personal beliefs that healthcare professionals hold. It may violate healthcare workers' personal ethical values, or it may violate their religious beliefs. If nationally legalized, will healthcare workers be forced to participate in patient care if they do not feel comfortable? Some workers may fear they will be forced to participate in patient care if nationally legalized. There is also concern that physician-assisted suicide is a slippery slope. There is concern among healthcare professionals that physician-assisted death may become a slippery slope if nationally legalized. For example, will administration of the lethal drug ever extend beyond terminally ill patients? What if a patient is not terminally ill but has a wish to die? As for nurses, the American Nurses Association prohibits nurses from participating in physician-assisted death. Interestingly, this statement was posted in 2013 when 4 states had already legalized physician-assisted death. So, what are some of the solutions? Well, physician-assisted death is a complex issue, and there are multiple solutions to the issue depending on your personal stance. But it's important to identify individual beliefs on the issue. It's important to educate yourself on the pros and cons. And it's important to write to local or national representatives about your beliefs if you feel strongly about this issue and want to create change. Have conversations with patients about end-of-life care. Here's just a summary of what we have talked about in this PowerPoint. Physician-assisted death involves the lethal administration of a drug to a terminally ill patient to take at his or her own will. It is legalized in 7 states and Washington, D.C. It is a personal, medical, and national issue and has caused several debates. The American Nurses Association prohibits nurses from participating in physician-assisted death.